Let me ask you about the health care bill for a second, because the polls seem to say that the Obamacare, as it's called, which you voted against, Congressman Nye, is very unpopular. But there are probably some parts of that bill, including free preventive care like mammograms and cholesterol screenings, no more lifetime coverage limits, plans can't cancel coverage for people who get sick, no denial of coverage to kids with pre-existing conditions, getting rid of the donut hole, free immunizations for children. There's a lot of provisions inside that bill that probably are very popular with Americans that if the whole bill is repealed would go away. So I'll start with you, Scott Rigell, because it's your turn to ask first. Do you want to repeal this entire bill and start all over again? What is your view if you got elected to Congress? What would you support?
Thank you, Joel. I think this is another clear contrast for folks to consider as they go into the polls on November the 2nd. By the way, I don't refer to it as Obamacare. I think that's pejorative. I think it kind of sets a negative frame on the whole topic. It was passed by our United States Congress, and I just call it the health care bill. I am for a full repeal and replacement, so it had to be simultaneous. So to think that we'd be without something and we'd just be back where we were, that is not the case. So as I look at the bill, you know, what did Nancy Pelosi say about it? She said we have to pass the bill to know what's in it. This is not leadership in my view. And I think it's not good for our country to have leaders in place who think that that's the kind of path that we can go down. So I would vote to repeal it. I'd vote to replace it. I'd look forward to working with our president on many of those items that you just mentioned there, Joel. There's some good things in the bill. But overall, it's one of these things that's creating uncertainty in our economy. There's not an entrepreneur here who can tell you, or even a regular, working for, if you're a vice president of human resources for a large publicly held company, who can tell us exactly the cost and how this is going to impact your financial statement. So it's one of about 7 things that are really working against us in job creation, because investors and small business owners, we don't go to market, we don't create jobs when there's too much uncertainty. And that's what this Congress, although well-intentioned, has given us.
So want to create more uncertainty if you change the law? Because right now I assume a lot of companies and healthcare companies are trying to adapt to the laws that was passed. If you're saying, well, we're going to go back and change it, now you're adding more uncertainty to their job to...
My view, Joel, would be that, and the entrepreneurs that I've talked to and had the great pleasure of talking to over the last 16 months would be that their view, they'd see that as, this is very positive. They wouldn't see this as a negative. They'd see it as a positive because they think, well, even if our prices are going to go up, they aren't going to go up as much if we go down the path that I'm suggesting we go down.
Congressman, you voted against it. Can I assume that you would like to see a majority of Republicans in the House of Representatives so you can make sure this bill gets repealed?
I'm going to agree with Scott on one point here, and that, again, I think that we need to make major changes to that bill. Now, whether or not we talk about repeal and replace immediately or amend, to me, is a semantical difference. I'm not interested in getting into a partisan battle on this bill. That doesn't solve any problems, it doesn't help anything. What I want to see happen is that we can get together, and as a moderate, that's what I try to do. I want to sit down with Democrats and Republicans and talk out what we need to change about this bill and support amendments to do that. There are some fundamental things that need to be changed, and I would support making some pretty fundamental changes to this bill. I think one of the big flaws of the bill is that it offers the idea of finding some savings in the way we transact healthcare in this country, but those are in the future. But it provides some very real costs up front, very real costs on individuals, but also on small businesses that I find onerous, particularly at a time when we're asking our small businesses to help us get out of this recession and knock this recession out. It's difficult to load more burdens on them at this time when we're asking them to take some tough choices, to go out and take a risk, hire a couple extra people, grow their business. You asked about uncertainty and whether changing the bill would create more uncertainty. I don't agree that it would, because right now there's a lot of uncertainty. This is over 2,000 pages. I know because I read them all. It took me a long time. It was very dense stuff, but I read it I got an understanding of it, and I decided that it wasn't the right way to go forward, and that's why I agree that we need to work together to amend it. But let's not play politics with it. Let's get down into the details and really work to amend the things that don't change. That's the best way to provide certainty. Our small businesses looking at this bill right now, they're already confused. They're unsure right now how to even read the effect of this bill on them. I'm very sympathetic to that. What I want to do is again, I'm about taking a fact-based approach. I know that might sound novel in politics, but I want to listen to business community, and I've already started to try to do things like eliminating mandates on small business, like the 1099 requirement. Take some practical cues from our small businesses and go about changing that bill into something that will work.
Kendall.
Did you read the first 500 pages? You couldn't have, because you wouldn't be here. You'd be brain dead. I started off reading that thing, and it was awful. You know, Scott got this one right. You sort of got it right, but I do fault you for this. I asked you 3 times to come and talk about health care, and you didn't do it. And I fault you for that. You should have come to us and said, hey, I am going to do this. This is what I think we ought to have, and you didn't do that. When you pick me to be your congressman, you will know where I stand on an issue before I vote on it, period. And that's what has to happen. We need to have a discussion about something as monumental as this health care bill. And that's what should have happened with you, Glenn. I'm sorry to say that, but you should have. I wish you'd have come. On the health care bill,
Come where?
I was the chairman of the Republican Party.
Let me come to the party and talk about that. Okay, I just wanted to, I didn't know what exactly you were referring to.
I don't like to talk about my past a whole lot. The health care bill, in my view, and as a matter of fact, we're going to be talking about it in my headquarters tonight. Mike Price from Ohio is coming down, Dr. Mike Price, and we're going to talk about it. And I believe it should be repealed and replaced. There are about 10 different things in the bill that's currently there that are good. We need to keep those. And I told some of the people that come in, I said, if you talk to a politician and they just say, repeal, don't talk to them. If you talk about repeal and replace, that's another thing. A woman on the radio show called in and said, okay, smarty pants, if you were talking to the president, what would you say when he started down this path? I said, we have a health care program in this country. It's called Medicare, Medicaid, and prescription drug, and S-chip. Fix those first, and then we'll go talk about what we're going to do to give us a better chance at medical care in this country.
All right, this is your last, go ahead.
I respond because Kenny said that I didn't come to respond to his invitation. I just wanted to offer, and Kenny said this at the first debate, I did offer an alternative to come meet me in my office, and he chose not to do it. But I think at the end of the day, it's important to mention that I did a lot of outreach on that bill, exhaustively, and yes, I did read the first 500 plus the other ones, plus the 200 pages that came out 3 days before the vote. It was an exhaustive process. At the end of the day,
that poor guy, is that what you're saying?
At the end of the day, I took the tough decision. I voted no. You know, both of my opponents in this race agree with my vote on that.
All right, let me ask you a question about light rail, because that's very important to a lot of people in this room. There's organizations out there that are avidly supporting this. We're waiting for a study that's going to come out sometime in 2011. And possibly there's going to be a referendum on whether light rail ought to be extended into Virginia Beach from Newtown Road out to the ocean front. That's going to be a very expensive proposition, and what we are told is that most of that money would have to come from the federal government, not from the taxpayers of Virginia Beach or the citizens of the state of Virginia. Some would probably come, but the majority, as with the part in Norfolk, would come from the federal government, which means presumably that the leadership here in this region is going to be coming to the congressman and saying, please go lobby Congress for $500 or $600 million to fund the light rail project in Virginia Beach. Tell me, first of all, would you do that? And second, how do you make the case that it's necessary for the entire United States of America for us to have a light rail line going from Norfolk out to the Virginia Beach ocean front? And I'll start with Congressman Nye.
I've already supported funding to help develop the light rail system. I think it's part of an integrated transportation system looking forward in Hampton Roads. We can't be dependent on having everybody driving on 264 all day, every day. We know what the condition of the road looks like. I think it's part of achieving transportation diversity and getting some of those people off that road, getting some folks off our interstates and giving them another alternative. That's why I've supported that. It goes to a larger question of transportation needs. Again, this is an area where the federal government, the state government, and the local governments need to work together to make these things happen. And I want to ensure that we get our fair share of attention in terms of development of things like rail. It's not just the light rail, but also passenger rail and high-speed rail. The good news is I have a very good track record of working in a bipartisan way with folks at all levels in Congress and with the governor and with the folks here at the city level to try to do things which I think are in the best interest. And if Virginia Beach tells me that they need my help, Norfolk tells me they need my help in trying to get something for our area, then I'm going to fight for that.
Ken Golden.
I do not support the light rail system as it's currently planned. I know what works in rail because when I went to Oxford in 2000 and 2001, I was spoiled. I could take a train to work. I could take a train to London in an hour and 20 minutes, and those work. I could take a bus. The light rail system that we have planned currently that takes people from downtown Norfolk to the beachfront makes no sense. It does not get people off 64. It will not be something that people will ride. It is a developer's dream, and that's all that it is. Show me a system that gets young people, young enlisted people, young officers from their berthing area, their living areas in Virginia Beach, and puts them at ODU, and puts them at the Naval Station, and puts them at Oceana, and puts them at Little Creek, and puts them at Dam Neck. Show me that system, and then I'll be supportive of it. This system doesn't do anything. Now, if you say, well, it's just a start, well, show me the rest of it, and then we'll talk about it. And oh, by the way, your figure of $500 million ain't even close.
I was only maybe talking about the federal share, and you're right. Scott Rigell.
Well, light rail and high-speed rail needs to be part of our overall plan to keep Americans moving. So, in principle, the principle of light rail, I do support. I have the pleasure of meeting with Dr. Cook on a regular basis and talking about our economy and transportation. And Joel, you're absolutely right. I mean, it requires massive subsidies at this point for every $2 ticket that's being paid. The real cost to get a person from A to B is like $20, so it's being subsidized to the tune of about $18. I see infrastructure, roads, bridges, and tunnels as capital investments that pay off over a long period of time, not so much as an expense on a balance sheet or an income statement, but really those things that we do because they make sense long term. So I don't think we have to get to a point to where the revenue exactly matches the cost of the trip. There are some things you do, you move forward with because it's the right thing to do, and it moves our country in the right direction. The key here really is to get we're under so much budgetary pressure right now that, man, the fireworks that go off, you bring this up in a city council meeting because of the intense pressure we're on. Our school teachers haven't been paid or given a raise in 3 years. So how could we justify, light rail if we aren't even paying our school teachers? There's a lot of pressure. Again, it all pivots back to how do you get your economy going again. And there's some real differences on how we create jobs and how do we get our economy moving again. And let me use my remaining 30 seconds just as a point of clarification with respect to what the Congressman said about health care. We're not talking about just differences in semantics here. I truly believe that the bill is unconstitutional. It is imposing a fine or a penalty or a tax on an American citizen if they don't buy health insurance. This is unprecedented in our American history. I believe it's unconstitutional. I don't know his view on that, but I don't think that's the principle-based reason that he is opposing the bill.
All right. Well, let's go ahead. We're at the end of our questions, or at least my questions for now. And people here do need to get back to work, but I did tell each candidate they would get 2 to 3 minutes here to closing statement, as it's traditionally called.